While I have you here and, with everything that's happening in the community right now and in the entire country, we're looking at case numbers that are saying over 672,000 cases in the United States, 33,000 deaths. So 33,000 deaths so far. Just yesterday in New York City, there were about 630 deaths. So, just starting off this interview, if I was to ask you how to process these numbers as a public, or as somebody who's just trying to understand where the risk factor is, how would you sort of describe it for our audience?
So from a numbers perspective, I would say that the numbers are better than we projected initially. I think the experts, the CDC, WHO, Dr. Fauci, were concerned that the numbers would go as high as 1 to 2 million even. In a country that's over 300 million people, 1 to 2 million may seem like a small amount, but
Right.
the rapidity, how fast this had spread and how quick it could spread from person to person, 1 to 2 million was not a small number at that time. The fact that we've had, as you mentioned, something around, like 30, the number of deaths we've had now is substantially less than initially was projected. That's because of the measures that we took early on. So in terms of processing those numbers, it's still devastating to what it did to the hospital systems and what it continues to do, depending on where you are. But the numbers are relatively better than we projected, simply because of this measure of social distancing and staying at home. That was probably one of the most substantial things we did.
And in terms of, understanding these numbers again, so you're saying that in a way we should be glad the numbers are lower than what was expected in the beginning.
Yes. And sorry, go ahead.
Yeah, no, go for it.
Yeah, so I would still say that it's not to de-emphasize the effect that it's had on the hospital system. The hospital system overall in this country was very overwhelmed, especially in New York, where I am.
Right.
We had far the only state that had, like, next below us was New Jersey. Then it went down to California. At one point, we had 10 times the number of cases as New Jersey and 4 times the number of cases of California. So we were very drastically hit by this, and everyone was overwhelmed, even with the numbers that we had. So imagine if it was not, that projected number of between 100 and 100,000 to 200,000 deaths as it was going to be, but it was 1 to 2 million, 10 times that, we would have been far more overwhelmed. So it was still a huge hit to the hospital system, and continues to be depending on where you are, but relatively controlled compared to what we thought, because of the measures that were taken by hospital administration and our governments.
Definitely, Dr. Bahl. I kind of want to talk to you about this hospital system and what has happened to the entire healthcare system. You are based out of Brooklyn right now. We are reporting to you here from Astoria, which is in Queens, New York. Both areas have been hit so terribly. They're being called one of the epicenters of, this entire COVID-19. Could you talk to me about what is actually happening in the ERs, in your radiology department? I know you've had to interact with several patients that have COVID-19 and other complications as well. We're hearing things like it's a war zone. It's a very complicated situation that the doctors have to prepare for every day. What is happening?
So I would say that things have substantially changed. First of all, I think when all of this had started, it was a huge, as I mentioned earlier, a huge hit to the hospital system. So not just my hospital in Brooklyn, but a number of the hospitals in Queens, Manhattan, New York overall. I think we were the hardest hit, of course, definitely hardest hit in the country. And what was happening at that time was that it was so bad that we were trying to triage patients, kind of tier who's the most sick, who looks the least sick. And for people who were coming in with these COVID-like symptoms, or what we call ILI, influenza-like illness symptoms, when they were coming into the hospital, we had a tent outside because the volume was so great. It was so difficult to be able to move patients from the emergency room up to the floors and up to the ICU. So it was basically, just imagine a cup that was overflowing. It was exactly like that at the time.
Wow.
Since we were managing these patients and they were, getting intubated, meaning tube going down their airway to manage them as they were moving along, the hospital was our hospital and a number of hospitals in the area were definitely overwhelmed by that at one point. Now, where we are is the numbers have gotten relatively better, as a lot of people have been hearing. since the curve has been flattening, where we are right now is in a stage where, the people are still either getting cured,
Right.
and leaving the hospital, or they're still sick on a ventilator and they're very, very difficult to manage. So when it started off with the ER just being utterly overwhelmed, I mean, at one point I walked into the emergency room to see some consults where I was called to potentially operate on patients. And when I walked in, it really was like a war zone, just like people have reported on my hospital in a couple of other news outlets. It really was at one point just absolutely overwhelming. People in PPE covered from head to toe, and we had set off certain areas where one set of patients could be and another set of patients could be, and it was, each bay had one patient to the next, and that's how it was at one point. Now that's sort of shifted over to our ICUs a lot more. Right. And then you were asking about my department. So I'm an interventional radiologist.
Yes.
And so what I do is I do minimally invasive image guided procedures. And with that, where it's really come to us now is initially it was not. It was primarily the cough, fever, and all those things that you've been hearing about. Now, what I'm seeing more of is, because the ER is less hit, and now the ICU is just brimming with patients, I'm now seeing more of the complications of COVID. And that means kidney failure, heart attacks, and blood clots in the lungs. So that's the type of stuff that we're starting to see now. And that's where the system's overwhelmingness has sort of shifted to other departments.
Could we perhaps reflect on, the coronavirus itself right now? Because I think you bring up a really interesting point that now you're seeing complications that are arriving through the ICU. You're having to take care of patients beyond just what you were doing prior in the last couple of weeks. Could you reflect on some of the insights that you have found in this virus and the developments? Why is it so harmful to the lungs and the rest of the body? And if you are a high-risk patient, how high at risk does it put you?
So that's a good question. So I want to first clarify. I want to give all the credit to the emergency room physicians and the ICU doctors and everyone else involved who was trying to make that first line, or front line, as we say, run. Right. I came into the game, yes, early on, because I was taking care of a certain set of patients who were coming through the door, but largely this is where we come in terms of the later complications, as you're asking about now. So I want to give a big shout out to all of them for their initial management of the wave. Now, what's going on with respect to how you were asking about how it's affecting the lungs? It's two major schools of thought in what was going on. Basically, what the virus has done is that when it enters the airway, it goes into the very small areas of the lungs where gas exchange occurs, basically where oxygen and CO2 are exchanged in the very small airways. And in that area, what it was doing is producing lots of basically inflammation and fluid buildup that was not allowing these patients to breathe well. And because their breathing was so impaired, that's why there was this whole move to put them on a ventilator very quickly.
Right.
As our understanding of the disease evolved, what we started noticing, it was not simply limited to just an airway problem, but it's also related to small, tiny little blood clots that are formed, what we think is related to the inflammatory response of the virus, where blood clots have formed, and they're actually forming in the arteries that supply the lungs. So it's still an oxygen CO2 exchange problem, but it's kind of coming from the artery problem, not just the airways. So we've got a sort of mixed picture of patients. Some have one, some have the other, some have both, and that's what can make them very sick. So we're seeing both of them, and I really come in when it comes into the blood clot problem. That's where I really step in.
Wow. And in terms of testing and treatments, looking at the complications on all ends of this, from the frontliners to now when you're coming in and you're seeing all these complications also develop, we are hearing everything from the anti-malarial drugs to blood plasma. We're talking about antibody testings. Where do you really see some correct testing happening, in which we're actually able to test a lot more individuals, because they're saying that that's very key to reopening, testing and mitigation. So I would love you
Absolutely.
to, reflect upon that.
Sure. So, with regard to testing, I think there's no one who would disagree that we need a lot more tests. I believe that the state who had the most tests was New York. We had over 500,000 tests, but the population is something around 19 million people. So 500,000 tests is a very tiny fraction of what we've been able to do as a hospital system overall in the entire state. And each state beyond that has far fewer tests than we actually need. The primary test that you've been hearing about
Right.
is the one that tests for the actual presence of the virus. And so it's called a PCR. That's the type of test that was done. And it's the test that's most widely done now, where they basically take a swab, and it can go either in the back of your throat, or it can go in the back of your nose. Ideally, the better test is actually in the back of your nose, and that's the one that was being largely done. Now, what you're hearing a little bit more of is the antibody test, and the antibody test is not really FDA approved. There's one company out of North Carolina that has been FDA approved, but by and large, I think there's around 70 other companies who've kind of come forward, but there's nothing, and there's no at-home test or anything like that. So the antibody testing is sort of the new player in the game, but really it's the other original test, the PCR testing, that's been done. But it's still overall, whether you're looking at antibodies or PCR, it's still insufficient. And what we're trying to do is just bring it to scale as a nation overall.
How do you then perhaps look at the next week and the week after? We're looking at, the hotspots they're saying are still in the peak. So I'm, considering that New York is still in the peak right now as we're speaking. And from there, we're going to see a flattening of the curve as everyone's talking about. Where are we in the next few weeks? If the testing and the vaccination are going to take time, the treatment is still, a conversation that we keep on having in the media. What should we expect?
So that's the magic question, right? Is what's the timeline going to be? I as an interventional radiologist I can largely only go off of what I'm seeing in terms of complications, and I can go off of what I'm seeing in the news, just like you. In New York, our Governor Cuomo, his last report was basically, we don't really know what the projection is. As you can notice, each state is kind of creating a measure for how long they think this is going to go on. You've got, and even country, right? India is looking at early May. New York is looking at May 15th. The President Trump is looking at for like May 1st or so. So everyone's sort of got different ranges for what we think the timeline is going to be. I would say that the most substantial thing, and this is not even just a physician, a healthcare worker factor, is really what all of you, everyone else is doing at home, is the continuation of social distancing and staying at home right now. That is going to be the primary determinant with respect to not only flattening the curve, but maintaining the flattening and actually bringing it down. The less people who are getting infected, the less of a spread, the less overwhelming of the hospital system, and therefore the sooner people can get back to work. It's largely dependent on not what we're doing in the hospital system, but what people are doing at home. I would say that's the primary determinant.
Do you know what the success rate would be if there is social distancing maintained for the next few weeks? How important is it for the next couple of weeks, according to you?
It's absolutely very important. It's very, very important. And it kind of goes back to the concept of something called herd immunity, meaning the more people who have been exposed over time, even for those few people who have not, the likelihood of them being able to pick it up is less so over time. And that's just because for the people who've gotten it, they've got immunity to it. So it's already died off with them. And those unfortunate, I wish I could say unfortunate few, but it's actually unfortunate many who end up dying with the virus. The virus, of course, dies with them. So really it gets to a point where you've got less infective people in the community. And therefore, for the people who never initially got infected, once they go back out and they're all interacting, you don't really have live forms of the current virus as it is, and that's where herd immunity comes from. We're not quite there yet. That can take some time, but that's ultimately where we're going to go to be able to protect us.
This brings me to the question of the hour, what we're all looking at right now, with so much happening on the federal and state level, reopening. Reopening meaning reopening of businesses, reopening of some of the states that are on lockdown, such as New York State. I know there has been a lot said in terms of politics and the government, but from a doctor's point of view, from a frontliner point of view, when should we be ready for reopening? And is it too early to have this discussion while the cases are still in thousands? Every day we're adding thousands and thousands of number of cases and deaths. So I'm, as a journalist, trying to understand if we are ready for this reopening.
So I wish I had the answer to that. I don't think anyone has the answer to that. You know, even today, between procedures, I was looking at the WHO's online stream, and as I said, I tuned into Governor Cuomo and President Trump's report yesterday. I think you're hearing a lot of different things. I don't think anyone knows the definitive time for when all social distancing is removed.
Right.
And you know, from a physician perspective, what I can really say is that just my understanding of epidemiology and what we understand about how it's transmitted, the less people who are getting affected, the less who are overwhelming the hospital system, the less who are dying. And so it's very much a domino effect. But then again, it goes back to social distancing as it is. That timeline I don't know, but now you're asking, is it too early to start the plan? No, I don't think it's too early. I think the fact that the curve is flattening. I can't say it's completely flat, and if you're an optimist, you might even say the numbers are starting to decrease. I think once that starts to happen, it doesn't mean overnight you go back to normal activity. But I think it does take a lot of planning to reopen, whether it's a state or federal economy. It takes a lot of planning, and I think it does happen in phases. And I think that conversation should begin now. I think that's fair. But for everyone to let their guard down,
right,
just say, oh, it's okay, I'm going to walk around without a mask, I'm going to go back to my normal activities. No, I don't think now's the time.
You know, this brings me to one of our most popular questions coming in from the audiences right now, which is this whole concept of how we're going to have a new normal, perhaps when we are reopening these states. How it may not be just how we always gathered in hundreds and thousands of numbers. From a health point of view, specifically, what is this new normal that is going to be in America for the next few months, so that we are able to combat it and also able to make sure that it doesn't come back?
Well, you said a really profound thing there, which is you said new normal. And I think a lot of people are asking that question, when will things go back to normal? And I think you hit hit it right on the head, which is a new normal. And that's exactly where we're going. And I really agree with that statement, because the way we're going to look at our social interactions now is very different. What we're really being asked to do for the first time ever, as far as I can understand in our history,
right,
is to think on a level that affects not just 1 billion, not just 2, but 7 billion people. Something that really unifies us. We've talked about multiple times throughout our history, this person has an enemy that they're fighting, and countries and faiths and everyone's kind of, that's been our normal in the past. Now, for the first time, 7 billion people have a common enemy and a common unification, which is a reestablishment of what's most important to us. And I think that's starting to be becoming our new normal now. What is able to be done remotely? What can be done over conversations like this, where you don't necessarily have to be in the same place? I think that's our new normal. But also, I think what our new normal is also going to be is the embrace of when you are together, really valuing that time with your friends and family, and not taking that for granted. I think we're getting a new normal from a digital perspective on what can be done if it needs to be done, but then a reassessment for the value of what it's like to be when we're together and to really cherish those relationships. I think that's a huge thing that I want people to feel. I feel it as a physician in my interaction with patients, and I want people to know that they should hopefully feel not just as patients to doctors, but us as a people, 7 billion people getting to feel that as our new normal, as you say.
And if I was to ask you right now, from a health point of view, what are some of the biggest unknowns, or some of the biggest concerns for doctors nationwide and maybe worldwide? What would you say?
I would say one major thing is the rapidity with a virus can alter its strain. So, right now, each year we get a seasonal flu.
Right.
And we have a vaccine that tries to approximate or predict which strain it's going to be so we can give the flu shot for that particular strain of flu that we think is going to come up. Well, as you know, this is a novel coronavirus. So it's the first time we're ever seeing it. So our major concern is that one, will we have a vaccine? And I'm sure we will at some point, but we don't know when. It can take as much as 18 months or so, a year to 18 months. And the other thing is, even if we create one, is there going to be a seasonal COVID, like a COVID pandemic, just like the flu has done, until we really have enough herd immunity for that particular strain? I think that's one major concern of mine. I always wonder, right now, each time I'm having to put on a mask, anytime I walk outside of my office and interact with everyone, I'm like, oh my gosh, is this going to be a continual thing every single season where I'm having to think about that? Every person I interact with, hands I used to shake, and people who I could just breathe their air and we could be in the same room, I have to question that each time as a healthcare professional. And now, is that going to come up, in August and September all the way through January, and then every year subsequent to that? I don't know. I think that's probably one of the most big unknowns for me right now.
This vaccination, how hopeful should we be about it?
The vaccination? So I think we can be hopeful about it. Right now it's still very much in the early phases. Because
Right.
if you really think about, we don't know how long this virus has been there. We suspect it was sometime at the end of last year, but it really only started rearing its ugly head at late December. So when you've got something that's now only really 4 to 5 months old, again, it's a novel coronavirus. It's so new that it takes time to just see what its activity is to really even create this vaccine. The hope is there, the work should still be done, but with respect to when it's going to be produced and especially scalable, I wish I had an answer to that. I don't think anyone really does at this point.
I want to take this time of the interview to sort of talk to you about your personal experience.
Mm-hmm.
I know it has not been easy for any doctor. So I've stopped asking, how are you feeling about it?
Yeah.
My question to you is, what has this experience taught you about medicine and about patient care? And, when you have to get ready every single day, describe to me that experience as just a normal person who now has to gear up to save lives while risking his own life.
So it's been a strange, very surreal experience. Every day feels like the same. Just like everyone who's at home says they can't tell what day it is because a lot of people are not going to work. Even for those of us going to work, a lot of the day feels the same from the perspective that, I wake up, I know I'm going to be taking care of patients, some who have COVID, some who don't. I'm going to be doing complex procedures on people who have COVID, people who don't. But every single day you're walking around wondering, am I going to pick it up from someone, or am I asymptomatic? Maybe I've already got the infection, I have no idea, and am I giving it to someone else? So every day you're walking around on the street with a mask, and the streets are practically empty, especially in the morning. And it's like imagine New York City being a ghost town. Well, I live in Brooklyn, and even that, I live in a very busy part of Brooklyn, and it's just like a ghost town a lot of the time, going to and from work. That's a very strange, surreal experience. And it's definitely changed my interactions with my patients. I take care of a lot of cancer patients. I do procedures to diagnose their cancer, and I do procedures to treat their cancer. Some of them are too afraid to come into the hospital, and that's imagine trying to balance, should I get my cancer treated, or should I hold off because I'm too afraid to get COVID? I'm having to have those conversations with my patients. Wow. And I can't even imagine. I know I really appreciate the support that we as healthcare professionals get, but I think a lot of support and recognition should be given to these people who are very afraid to come to the hospital and not really know what it's going to be like for them. And then with respect to my personal life that I'm going through, well, one thing is that I've got my first child on the way.
Congratulations.
Thanks very much. So my wife and I were very excited. We're into the third trimester now, but one of the hardest things to do was actually have to send her away from New York City. About she's been gone for over a month now. It's almost 5 weeks we're approaching. Just because every single day when I was walking around the hospital, I could not bear the thought of potentially contracting the virus and then bringing it home to her and our child on its way. So that was just too much stress for me. And while I've not let my guard down and I'm still careful with what I do at the hospital, I definitely am under less stress. I think it's one thing that's made it better, just knowing I'm not, having to worry about how she is. But
Right.
certainly the hardest part in all of this, patient care and complex procedures and all this, I was trained to do very well. But being away from your loved ones, especially when you've got your first child coming, that's been easily the hardest part. So I'm just really hoping, just like all of you, that this social distancing and everything gets lifted so I can have her back home and I can enjoy the rest of the pregnancy with her.
If I was to ask you how medical professionals such as yourself and other healthcare workers are handling the stress from personal life and their professional life, and how they really keep it together and keep themselves balanced, how would you respond to that?
I think everyone has various forms of coping mechanisms.
Mm.
Some people will play sports. It's music. Some people are just watching mindless television to keep themselves off of it when they come home from the hospital. I'm hearing everything. I think what's difficult is that you can't even have those social interactions.
Right.
So for me, I can say that because I don't have my wife at home, personally, I spend a lot of time doing meditation. I've been meditating over 20 years now,
Wow.
on a day-to-day basis. And I do a form of something called Kriya Yoga, and that's my form of meditation. And because I don't really have any human interaction when I go home as of the past 5 weeks, I do spend a lot of my time reading or watching something relaxing and meditating. And I try to share some of my meditations online through my Instagram community or Facebook Live and things like that. That's how I try to connect with people and kind of de-stress away from all this COVID stuff and try to find a way that I can center myself and help center other people. I think that's what keeps me personally relaxed. But I know everyone has their own way of doing it.
Let me ask you a question for our audience watching. And I think, mental health awareness is so important during this time period. Taking care of yourself is also very important. Your comments on mindfulness and how can someone practice it?
So mindfulness, I think, is something that everyone can do. It's a really great way to just start a meditation practice. The beautiful thing about it is that you don't have to be really experienced. You can even do 1 minute. I can tell you the longest meditation I've ever done was 7-8 hours, continuous. But I've had deeper meditations in just 1 minute than I've had in some of those like 6 to 8 hour meditations. That's just because of the mental state I was at. And I believe anyone's capable of it. And all it really takes is just finding a place, no matter where you are or what you're doing, no matter what your experience is, and just sitting down and just being aware of your breath. That's all. Just closing your eyes and looking at this point between the eyebrows and just relaxing your shoulders and just being aware of your breath as it goes in and goes out. And not thinking about the past, not thinking about the future, just being aware of what you're doing and being and kind of removing all expectations of yourself. And I think that's mindfulness meditation right there. If you just do that, you'll feel so relaxed even in a matter of moments. And I think it's something that everyone is capable of doing.
And how do you suppose we could handle this anxiety and stress that everyone keeps on talking about, what isolation has caused for many people? How should they handle that?
So I think two major factors. One of them is what you do for yourself,
Right.
and the other is how you interact with others. So they've done studies on this. I think there was a really well-known longitudinal study out of, I believe it was out of Harvard, and it looked at people over a number of years throughout their lifetime, and what was the definitive factor for happiness in these people. And it wasn't money, it wasn't fame, it wasn't a good job. It was their friendships, their human relationships with people. That was the single greatest factor. That was the determinant or the greatest metric of their happiness.
Wow.
And I think that's what was really profound, is that it's really established what is the thing that we hold most dear? It's those human interactions. So even though we can't be in our personal space anymore and exchange a handshake or a hug or a warm embrace that you can do in person, even getting to do that on FaceTime and through Zoom and just trying to reconnect and take that time, since we're not all rushing through the hustle and bustle of work, but we're able to take the time to reestablish our personal relationships. I think that's one of the really, really valuable things. And then in terms of personal wellness,
Yes.
mental health, that goes back to what I was saying. My personal favorite is meditation, because you don't need anyone else to do it. You can just do it with yourself. And if you're busy and you have kids that you're balancing at home, or maybe elderly parents, you need to take care of them. If you're fortunate to have a partner, spouse, or whoever, you can split that work with them and say, hey, can I just have my 5 minutes of mindfulness for myself, and then you can take yours. If you can't necessarily do it together, but that's something I think we can really do personally and with other people.
Dr. Sumeet Bahl, thank you so much for your time here on ITV Gold. I know we're running out of time here right now, but I would love for you to give out one last message to our audience, perhaps an advice right now, but also a message out to your fellow medical professionals, healthcare workers, everyone that's on the front line. I would love for you to address them as well.
So I guess for the people on the front line, or some of us who are maybe between first and second line and treating the complications, and everyone else out there who's been really involved, I want to give a huge shout out to physicians, physician assistants, nurse practitioners, nurses, the custodial staff, the technicians in the labs, the epidemiologists, you name it. I could go on and on. Just the sheer number of people who have put their minds and their hearts together to take care of all these people. This was something that we've not seen like this, at least in our lifetime. And I think just the ability to band together was really incredible. And I think one thing that's really important in medicine, we often use this term multidisciplinary care, and that's a term that I hope that we throw out forever. I want to say it's interdisciplinary care. We're not multiple teams. We are multiple teams who are interacting with each other. We are interdependent on each other, and I think that's one thing I really want us to take from this. With respect to the community out there and everyone else, my message really is very simple. I think the greatest thing that we can give ourselves, because I'm watching human suffering every single day, and I'm also watching human recovery every day, and I think, which is really encouraging. And I think one of the greatest things is this message of loving kindness, being being connected with people, but also without expectation. Connecting with people on a very deep emotional level and really valuing them, something that hopefully doesn't just go on through this pandemic, but lasts for a lifetime, something that we really, really remember about all of this. And the second thing would be, we often say this phrase, well, at least you have your health, because we've always valued that as the single greatest thing that we should have left behind if all else is lost. And I think that this has really taught us that if nothing else, at least you have your health. And hopefully everyone goes away thinking, wow, from here on out, I'm going to take ownership of my own health in terms of prevention, mentally and physically. And I hope people take that with them as they move on from this.
Well, I truly appreciate your time here with us on ITV Gold. I hope you and your hospital have enough PPE. Are you guys good with that? I've heard really good news on it.
Yeah, so the good thing is because just my hospital did such a fantastic job of garnering a lot of social support. We had amazing donations from a lot of well-wishers out there, and we did a really, really good job with that. My hospital was, even though we had to use masks for an extended period of time, I think a lot of people know that all hospital systems had to do that, but my hospital was very willing to allow us to wear it as we needed to and do what we had to do to make sure that we were protected and our patients were protected. So kudos to them for doing that. So I think we got through that reasonably well.
Yes, and I'm very glad that there is now enough PPE. We keep on hearing really positive news, and it's so great. And again, thank you so much for being with us here on ITV Gold, and we hope to have you back soon.
Thanks so much. It'd be my pleasure.